So gastric bypass surgery is one of the gold standard weight loss surgeries which has stood the test of time. The surgery involves reducing the size of the stomach into a small pouch and bypassing the flow of food and nutrients from the major part of the stomach into the small bowel for a particular distance before it gets mixed with the digestive juices, and then this facilitates absorption of the food. So it essentially involves rerouting the flow of food and nutrients from the major part of the stomach and the beginning of the small bowel so that the food gets absorbed only in a particular part of the small bowel. Now, contrary to popular perception, this is not surgery which punishes you in that it cuts the size of the stomach into a small size, but it is much more scientific than that. It interferes with the feedback from the bowel to the brain, thereby after you eat a small amount of food, you feel that that's enough. And it also flicks quite a few switches inside you. For example, in diabetics, it immediately brings about a change in the glucose metabolism, and it reduces insulin resistance. In other words, it improves insulin sensitivity. So much so that the patients immediately after gastric bypass surgery come off from their diabetic medications. Opposed to this, a sleeve is a simpler operation in that it removes the excess bit of the stomach, and it is an irreversible operation in that the excised part of the stomach is removed at the time of the operation. So a 2-liter capacity stomach is cut down to about 180 ml capacity narrow stomach. And so the weight loss is essentially due to restriction of the capacity of the stomach. So there's no malabsorption with a gastric sleeve. So if you look at the technical aspects of the operation, a gastric sleeve is technically much more simpler than a bypass operation. So a gastric sleeve is purely a restrictive operation with no malabsorption. And a gastric bypass has got a combination of restriction and malabsorption. So needless to say, if you look at the long-term results, the results following a gastric bypass is better, almost to the order of about 10 to 20% when compared to a sleeve. So that's a very good question. A gastric bypass is better for patients with diabetes, for patients who have got a sweet tooth, and for patients who have got quite a bit of weight to lose. It is also good for patients with reflux disease. On the other hand, a sleeve is better for patients who have undergone open bowel surgery in the past, and also for patients who do not have much of weight to lose. And a sleeve is also good for patients who are volume eaters. That is, they need to eat a lot of food before they start feeling, okay, I'm now full. And a sleeve, because of its relative simplicity, is better for patients who have undergone open abdominal operations in the past. So with a gastric sleeve as a ballpark figure, you can expect to lose about 3 to 4 stones in weight at the end of 2 years. And for a bypass, you can expect to lose about 6 to 8 stones at the end of 2 years. However, what we have got to remember is that following the surgery, it is very important to stick to a healthy diet and lifestyle if we have got to optimize the outcome of the operation. The common myth is that you can have this operation and then you can continue with the unhealthy eating habits and you will still lose weight. That's a myth. You have to work with the operation to maximize the outcome after the operation.